The Council for Medical Schemes just letting the media in on the released Circular 27/2003 that looks at the benefits and increases in the medical sector. This is where then the registrar, accompanied by members of the council today, just broke it down to us in terms of just making it easy for people to attain medical aid. There have been concerns over time around how expensive private healthcare has become in the country, and now we are seeing the scheme coming through with proposals around just increases that are in line with the CPI projections of 2024. I'm going to bring into the conversation now one senior manager here at the council who just let us in on really what came out of this process. And we know very well that this is where you just intervene, and this 5+% just is informed by just your projections looking at the CPI increases or expectations thereof of next year. Let us in on really what came out of this briefing here today.
Oh, thank you, Mr. Lehodi. Obviously, what we have done today is to announce to medical schemes and the public that the office is recommending a contribution increase that is linked to CPI. As you would know, that the South African Reserve Bank Monetary Policy Committee has, published projections for the 2024 financial year. That is, the average CPI is projected to be 5%. The medical schemes, the Council for Medical Schemes, in order to contain costs, is proposing that medical schemes should align themselves to the CPI when submitting contribution increase assumptions. We do allow, obviously, for an additional percentage or so that medical schemes can add, depending on the demographic profile and utilization patterns that each medical scheme face. But all the submissions, when submitted to the office, will be evaluated on the basis of the strength of the motivation, and on that basis, the office will either, approve or reject such submissions.
We know very well, if I can come in there, that the economy has not been doing well for quite some time, and this is informed by that as well, looking at the CPI and just this notion that medical aids are expensive here in South Africa. Private healthcare is very expensive over time, but we're seeing you trying to bring everyone to the table just where these projections are concerned.
Yeah, you will see that over time, the population covered by medical schemes has remained unchanged at about 15 to 16% of the population. That can only be evidence that people do not afford medical schemes. The other indicators that we've been tracking is the size of families that are covered by medical schemes. We have seen over time the average size of the family reducing. It will be that the household are making decisions to say who to cover or not to cover, so that they're able to continue to afford the medical scheme coverage. What it does then is that the choices that people make is that they will remain in a medical scheme because they have a need, and those that do not have a need will stay out. What then that does is that costs go up because medical schemes will then cover mostly people with adverse health conditions. So you do not have effective risk subsidization from those who are healthy, from those who are young, to the old and the sick. And that can only be explained by affordability, that medical schemes are not affordable to a majority of South Africans.
Just before I let you go, where are we in terms of the introduction of the low-cost benefits where the schemes are concerned? Are we moving any closer to that realization as a scheme here, the council working with the registrar?
Yeah, as the registrar has reported earlier today, the work is far advanced in terms of submitting the analysis that the office has conducted to the minister, and the minister is the one who then make pronouncements on the process direction going forward.
And just quickly, sir, before I let you go, deadlines, you mentioned November, you've mentioned just dates as well. When can we expect everyone to adhere to this, and that room for people then to appeal or come to you to approach you to say that 5+ is not something that's going to work for us?
Yes, I think what is important to us is that we want to complete this process as early as possible, in order that we allow medical schemes to communicate the contribution changes to members of medical schemes. By law, medical schemes are supposed to give their members 30 days, notice before implementing the new changes. That is the contribution changes and the contribution increase. So it means that the office must conclude this process by end of November. We anticipate that the majority of schemes should be concluded by that time, unless there are those schemes where there is no agreement between ourselves and them in terms of the contribution increase or benefit changes that they would have submitted to us. But we will endeavor to ensure that everything is completed by end of November in terms of announcing the approved options and contribution increases for each of the medical scheme options.
So thank you very much for your time. The council really hard at work here to ensure that there's transparency, there's transformation within the sector, and no one is left behind. COVID-19 just also presenting a dynamic that shows that there is vulnerability in terms of the health systems in the country. But we've seen the council saying that there is also that process where these medical schemes can approach the council on an appeal basis of some sort to say that 5+ is not going to work for us, and they'll have to motivate going forward as to what would work that would be in line with their CPI projections here for 2024. I'm Katlego Legodi, SABC News in Centurion.